Well, welcome everyone, and I am absolutely delighted to introduce Dr. Steve Tillis. He's been a Rotarian for over 29 years and is actually a past Rotary president. After 40 years as working as a periodontist, he shifted his focus to serving communities around the world. He now serves on the board of Together We Can Change the World, which supports women and children in Southeast Asia. Steve has been closely involved with the Cambodian Community Dental Clinic, a project our International Service Committee helps support. He's previously presented to us about the clinic, and I'm thrilled to pieces to welcome him back all the way from Denver, Colorado, for his update. So, welcome, Steve. Thank you.
Thank you, Susan. I appreciate it. After that introduction, I think I can just go home. You basically stole my thunder. Um, it's a pleasure to be here, and thank you, Rotary Club of Lake Placid, for having me, and also for contributing to this program. And in the next 15, 20 minutes, I hope to show you how your money is being spent and what it is being spent on. Um, I'd also like to thank Susan. Susan was a past board member of Together We Can Change the World and was instrumental in many of the projects, and is also still working with Together We Can Change the World with working with wells that are donated to rural communities in Cambodia around Siem Reap. So thank you, Susan. So I just got back from Cambodia, um, actually 8 days ago. So I can give you firsthand information. I was visiting the dental program and making sure it was doing what it's supposed to do and working the way it's supposed to. I try and go every 2 years, which I'd been doing other than COVID. But I was there 2 years ago and was back, say, 2 weeks or less than 2 weeks ago. So I still have jet lag. I also have a bad cold, which I brought back from Cambodia. So I apologize if my voice is a little off. As Susan mentioned, this dental project, which Together We Can Change the World is a nonprofit founded in about 2009 by Scott Friedman. And the mission is to empower and educate women and children in Southeast Asia. And we have projects in Cambodia, in Thailand, in Malaysia, in Philippines, and we recently started some projects in Vietnam, which we visited last week, along with Cambodia. So it really been doing good things on a relatively small budget, foundation-wise. But we have our signature projects we work on, and the dental project that you help fund is one of those. The dental project in Cambodia takes place around Siem Reap in the rural communities. The rural communities are very extremely poor. A lot of the homes don't have electricity. They don't have clean water. To get clean water, they go to a lake about a mile or two away and haul back dirty water. That is changing somewhat with the donation of wells that are drilled there to give these families clean water. So dental care, unfortunately, is not at the top of the list when you talk to these Cambodian people. You know, people without clean water, without food, it's tough. But the dental care it's a real problem. And 2 years ago, when I was in Cambodia, I screened over 200 kids in a school screening program where they screen kids for health, including dental. And in one day, I screened over 200 kids. I screened them, and I'll show you a picture in a couple minutes, basically using a tongue blade and a flashlight, and looked in their mouth. And with training of about 20 seconds, anybody in this room could see what I was seeing. Over 95% of these kids had visible decay. meaning teeth. You could see large holes in the teeth. Some of the teeth were decayed to the gum line. And these were kids in their age range of 6 to about 12 to 13. Um, and it was about over 95% of the kids. The ones that did not have decay, when I questioned the mother, usually the mother, um, these were kids who brushed their teeth, but there were only a handful that were brushing their teeth on a regular basis. So the dental program started, it's really a preventive dental program for the most part. It started in the schools in Cambodia. Right now, it serves 6 primary schools and 12 preschools. Over 3,000 kids are benefiting from this program. Hopefully, we're reducing the decay rate um, through education in the schools for the kids and also community education for the parents. It started out as a school-based program, giving the kids toothbrushes, toothpaste, instructing them how to brush their teeth, giving them some education concerning dental care and dental disease. And then it realized 2 or 3 years ago that unless we expanded into the community, it's hard to keep this program going and to have the impact. Initially, in the very early stages of the program, the toothbrushes were sent home, but they were gone. The parents didn't care about them, and they were either lost or used to clean a motorcycle chain or something. Who knows what they were used for? So basically, it was brought to the schools where the kids each day brush their teeth in schools, supervised by the teacher. That is still done. Um, but it's also expanded to the community where we're teaching basically the mothers, women, about dental care and the importance of dental care, showing them how to brush teeth, and we're sending the toothbrushes home now with the kids. So one thing that was done was in conjunction with um, our NGO on the ground, which is Cambodia Community Dream Organization. They're the ones who implement the program. We fund it and oversee it. But Together Cambodia Community Dream Organization worked with the schools and the government to make it a requirement for kids to brush their teeth to be able to go to school. This is done. It's hard to monitor this, but hopefully it's making an impact. So hopefully by expanding it in the community, we're helping the kids with with dental care at home and also with the parents, hopefully with dental care at home. Along with dental care, we're instructing them on education concerning dental care, which um, includes toothbrushing, but also about diet. And a lot of these kids, they eat a very sticky, sugary candy, which is about the worst thing you can do for teeth. And so that complicates things immensely. But hopefully, with some small changes in diet and brushing can have an impact. Unfortunately, it's extremely hard to measure the impact because we can't do studies um, to see if there's a decrease in decay. So it's basically getting a feel for it, talking to the principals, talking to the teachers, talking to Cambodia Community Dream Organization to get an idea the impact of this program. Um, the other part of this program is, besides the dental education, kids who are in pain, which when I screen these over 200 kids, 10 to 15% on that given day said their teeth hurt. They were in pain. They are taken to a dentist in Siem Reap or to the hospital for dental care. And unfortunately, most of the dental care is just taking teeth out. Occasionally, they have some dental care for some restorations, especially if they're permanent teeth. But it's tried to get these kids out of pain. So that's the second part of the program, and that's part of what the funding goes to also.
There we go.
Susie, if you can put okay, so this picture was taken about 10 days ago, and this is a community education program for the community. And these are mostly women. There were a few men. And the two men in front are with Cambodia Community Dream Organization. I'm standing there also. And they're talking to the parents about oral hygiene. And this is done, as you can see, they're sitting on the ground. This is not and it's about 96 degrees and humid. So it's not the most pleasant situation, but a lot of women came and listened, and they sat there and listened to this program. Susan, next slide, please. So then we went to one of the schools where they were teaching dental care. This is a primary school. The kids are anywhere between about 6 and 12. They go to school in uniforms. They have to have uniforms. And again, uh, these schools are relatively primitive schools. There's obviously no air conditioning. They do have a building which is behind them, and they're getting education. What we also learned, talking to the principal after we observed the dental education that they were given, is a lot of these kids come to school in bare feet. They do not have shoes. And there's also a huge uh, need for uniforms because a lot of them can't afford the uniforms and they can't come to school without a uniform. So there are NGOs that support uniforms for these kids, and we're gonna attempt to provide shoes for these kids. Most of the shoes basically are croc-like shoes. They're plastic shoes. They cost about $2 a pair. If we buy them in bulk, hopefully less, and we can get these kids some shoes to wear to school. So, can you go to the next slides? So these are kids. They showed kids how to brush, and two of these little girls came up to demonstrate brushing teeth, how to do it for the other kids. Next one. So this was 2 years ago when I was screening kids, and this is basically what I was doing. I had a pen flashlight and a tongue depressor, and I was looking in their mouths. And again, about over 95% of these kids doing it this way had visible decay, which any one of you in the room could see if you put a little light in their mouth and looked. And most of these kids, if you look at them, and the rate of decay, the rate of dental disease, most of these kids, by the time they're 20 to 25, will be dental cripples, meaning that they will have loss of function or aesthetics, how they look. And unfortunately, in these communities where money is scarce, replacing teeth, restoring teeth is a tough situation. Next one, Susan, please. So these kids are extremely polite. They're extremely grateful. They love learning. They love being there, and they just live in such tough situations. If we can help them a little bit, I guess I use the starfish analogy. You know, there's so many kids there, so many kids in need, and so many adults. But if we can help a few kids, I think we're doing something important in the world. And there's a motto that uh, what was the motto? We cannot do all the help the world needs, but um, the world needs all the help that we can do. So hopefully we can live by that motto and help some of these kids have a better life and a healthier life. Um, the future of this program, it's going to continue the way it's going. Our budget for this program this year was $8,000. So $8,000 goes a long way. We're helping over 3,000 kids, giving them toothbrushes, toothpaste. 4 year or right before COVID, I also applied, had fluoride donated, and myself, along with other members of Together We Can Change the World, were visiting. We spent a whole day applying fluoride to these kids' teeth also. And then again, we're getting these kids to the dentist to get them out of pain, so they can function in life. So hopefully we're giving them a little better life. So that's basically what the dental program is, and that's what your money is going towards. Um, I, I look at the budget every year. They have to submit a report every year on their expenditures and the budget and what it's going for. So that is overseen. And again, I'm personally visiting the program about every 2 years to oversee it. And I'm talking to probably every quarter, at least to Colorado or Cambodia Community Dream Organization to make sure the program is going well. And at the end of the year, to talk about changes to the program that might be beneficial to the program. So I think your money is being used extremely well, and the money that you've donated, which we appreciate, is going a long way to helping some kids uh, in Cambodia. Um, I'm happy to open it to any questions at this point.
My question is, when you give them a toothbrush and toothpaste, is that for the year or is that just one tube of toothpaste?
We give them new ones every 6 months. Okay.
Okay.
And um, we've also tried, as long as the budget allows, to send toothbrush and toothpaste home, but also leave a toothbrush at school, provide a toothbrush at school so they can also brush at school. So, we're trying to get them to brush twice a day at home, once in the morning, once at night. And then once a day at school being supervised. So we know that that brushing is getting done at least once a day. But we're really trying to focus on getting it into the community, because to try and get it to be a lifestyle in the lives of these kids and the families, to try and make it a lifelong um, habit for them to care for their teeth.
Thank you.
Question. You mentioned sticky candy, that the kids eat a lot of sticky candy. Can you hear me?
Yes, I can.
I feel like a lot of the reading I've done anecdotally, traditional communities or more rural communities, they would have much healthier oral health. But then as more processed foods are introduced to their communities, aside from the oral hygiene, then this problem gets much worse. Are you seeing that in this community, or is it just, this is just a lack of education and supplies and whatnot?
Well, I don't think it's much different than a lot of communities in the world, even though this community is very, very poor. Kids want sweet things, adults want sweet things. They get this sticky candy. They also drink some sugar drinks. They make a sugar drink at home with water and something they put in it. I'm not even sure what it is. They do have some access to Coke and sugar drinks like that too. So even though they're a very poor community, the diet is horrible. They're not getting a nutritious diet for the most part. A lot of rice, because rice is cheap. And when we were there this time, three families, we brought 50-pound bags of rice because they don't have enough money even to buy rice. So the diets are just, they're a poor community diet. Unfortunately, they're still getting hold of sugar candy, and it's a sticky candy, and they love it. And it's the worst thing you can do for your teeth. And we're trying to educate. Part of it is not just brushing, and it's educating them about diet and about sugar diet. So we're trying to address that also.
What are your other sources of funding for the $8,000?
So each year it changes. We're getting as much as we can. I belong to a Rotary Club of Denver Southeast. I belong to a different Rotary Club for 26 years, Rotary Club of Denver Tech Center. Unfortunately, we dissolved because we became too small and too old after COVID. And for 2 years, they provided total, we were getting rid of our money, basically. We had about $100,000. And for 2 years, they funded the program. That ended when the club ended. So this past year, besides your Rotary Club donation, we got $1,000 donation from a family foundation, which each year donates $1,000 to this project. Rotary Club of Denver Southeast next year will donate to this project. And the rest of the funding count, the foundation of Together We Can Change the World, which we have a foundation that can support that. So we've been able to fund it every year, or find funding one way or another. It's like everybody else. We're all looking for money for projects. So there's a lack of money and no lack of need.
So since you've been doing the program, have you seen what impact have you seen from all of the good work that you've done? Do you see some improvements in the kids that you're seeing in the communities?
So as I mentioned before, it's very hard to measure because, we're not doing any studies, bringing kids in to look at decay rates and all that. Excuse me, I'm sorry. It's just impossible to do. So we're trying to evaluate it two ways. The number one way is to see how many kids we're sending to the dentist each year to see if that's decreasing, how many kids are in pain, and hopefully there are less kids in pain. And there have been a little less, although not significantly less. The other way is I'll go back to Cambodia in 2 years, and I'm going to screen kids who have been through this program, and see if I can get an idea of is there less decay for these kids who have been brushing their teeth and gone through education in primary schools for these past few years. So unfortunately, I can't tell you that we have a great measurement to do this. We don't. So we believe we're making an impact. Cambodia Community Dream Organization, which is the NGO on the ground, believes we're making an impact by talking to kids and parents and seeing what's going on. And I know that when I screened the kids 2 years ago, the few kids that didn't have any decay, the common denominator was they were brushing their teeth. The other kids, by and large, were not brushing their teeth. So hopefully that holds up. Thank you for your question. I wish I could give you a better answer, and I wish I could give you a better assessment of what's going on.
We really appreciate it.
Okay, one more question, Peter?
Yeah, can you say anything about the dental workforce in Cambodia, especially in more rural areas?
So there are a number of dentists in Siem Reap. These are fee-for-service dentists. Some of them we've tried to arrange with to do some reduced fee dentistry, which we've had a little bit of success with. Probably the biggest impact for dentistry in rural Cambodia are the dental missions that come over to Cambodia, such as Global Dental Network, who go into a rural area, set up a clinic for a week with 2, 3, 4 dentists, some hygienists, and they see kids round the clock for about 5 or 6 days and try and take care of as many dental needs as they can. I think in the rural areas that has the biggest impact. And when these dental missions go in, they're trying to do dentistry, not just take teeth out, but trying to do fillings and doing some dentistry that's meaningful in saving teeth. I think that has the biggest impact. And again, we continue to work with dentists in the area, Siem Reap, to do some reduced care for these kids.
One more.
One more.
Okay.
Steve, what support do you get from the Cambodian government? Have they integrated the program into the, whatever school curriculums there are, that sort of thing?
Yeah, the Cambodian government is providing a little bit of funding, okay, which I failed to mention. I'm sorry. They've started provide. They've seen the program. It's been presented to the Cambodian government, and they're providing a little bit of funding. Although most of this is local funding from the local areas, so they are contributing to this, and they also were supporting that the kids could not go to school unless they brushed their teeth. This came from the schools and came from the government. So hopefully the government is behind this to a degree. How much the government will and can participate in the future is I don't know. I mean, the government, you know, I mean, just to give you an example, when COVID hit, the government provided vaccines for everybody, and they instead of getting known good vaccines, they got some cheap vaccines from China, and a number of people died from the vaccines. So that's government trying to do something, but failing because of the workings of government.
Thank you.
Well, thank you, Steve, very much. Thank you, Susan.
Well, thank you, and I appreciate the Rotary Club of Lake Placid supporting this project, and hopefully you've got a flavor of what we're doing and how your money is being spent, and that there's oversight on for this money.
Thank
Thank you.
you. Thank you, Steve, so much for taking the time to do this.
My
And
pleasure.
thank you,
Anytime.
everyone, for the great questions. I think you got some great interest, and it's a wonderful project. And we've donated, I don't know, is it $1,000 yeah, and hopefully we can do some more to help. Okay. Thanks, everyone. Thanks, Steve.
Thank you.